they're saying, look, if you as a health system are found to be blocking the flow of information, you can get fined, I think it was up to $1 million per instance of information blocking. Now, why would a provider block the release of patient information?
Mm-hmm.
There's actually a very good reason why they might do that. I used to say the shortest putt for most hospital-centric health systems to improved financial and maybe even clinical performance, but certainly financial performance, is to figure out how they keep their panel of patients, consumers, in network. I mean, there's been huge consolidation in the healthcare provider marketplace over the last 10 to 15 years. What I mean by that is
Mm-hmm.
hospitals, merging with hospitals, but maybe even more impressively, hospitals acquiring physician practices. And those
Mm-hmm.
integrated delivery networks that are collections of hospitals and physician practices want to
Yeah.
coordinate care. And since over 90% of the way they get reimbursed is for what they do, that's fee for service,
Uh-huh.
if they can keep patients in their network, they do better financially.
Sure.
And that's not necessarily a bad thing, because they could also argue we can coordinate care better if
Yes.
we keep people in. But you shouldn't force patients to do that, right? And you could almost force them if you don't release their data to other providers.
Mm-hmm.
So that's a bad thing. The government said, if we catch you doing that, you're in big trouble. So I think
Mm-hmm.
that's helping with data liquidity. All the EMR vendors, Epic, Cerner, Athena Health, have done a lot of work to make their data much more available, make it
Mm-hmm.
available in a timely fashion. And one company, full disclosure, that I do work with, it's a New Mountain Capital-backed company, Ciox Health, is a major player in this space. And is EMR agnostic, and is working hard to, again, support these new regulations or help providers comply with these new regulations. Things like, I don't know
Mm-hmm.
how many of you in the audience have asked for your medical record or had a loved one who needed their medical record released. It's a pretty ugly experience
Yeah.
at most organizations. And most of these organizations, it's just not a competency they've developed to be able to know what to release, uh, abide by all the regulations, right? You don't just release personal health information willy-nilly. You have to track who'd you
Yes.
release it to and why, and did they have the rights to that and all that stuff. Ciox actually helps organizations do that.
Mm-hmm.
About 3,500 of the 5,500 hospitals out there, and is using technology to make it better and better over time, both the consumer experience, but also there are a lot of other folks who want access to those records, the payers, insurance companies, lawyers, Social Security, Disability Administration, and so on.